Hi, I'm Katherine Harris, and I'm the Home Health Director for UVA Continuum Home Healthcare with UVA Health in Charlottesville, Virginia. I've had the privilege of being in home health for over 10 years, working in an academic institution. In my current role, I oversee the agency, including program management, quality improvement, and work with our provider partners throughout Central Virginia to improve the care of patients, including those with heart failure. Today, we will be looking at the pivotal role home health plays in care coordination with providers in improving outcomes for patients with heart failure, especially in avoiding the emergency department. In the United States, there are 800,000 new cases of heart failure diagnosed annually. The prevalence of heart failure in the US continues to rise, with over 6 million American adults having heart failure. Among those with heart failure, women over 80 have a higher prevalence than men, and overall prevalence is higher in both Black females and males. According to the CDC, in 2012, heart failure accounted for $30.7 billion in healthcare costs. Annually, there are over 1 million visits to the emergency department due to heart failure. Management of heart failure in the community can be viewed through three key elements: medication management, self-management, and communication. A breakdown in one of these areas is often why an individual has an adverse outcome, such as seeking care in the emergency room. So why in general do patients seek care in the emergency room? In general, research tells us that the social determinants of health play a pivotal part in why individuals choose to seek care in the ER. It is an important point of entry to medical care for patients with acute illness, especially those with limited health literacy, and those who do not have access to education on the benefits of healthcare maintenance and disease prevention, which are key elements in the management of heart failure. Many patients presenting to the emergency department, especially those with heart failure, have complex diagnosis and multiple needs that require a more lengthy evaluation and coordination of care that cannot reasonably be provided in an environment that is more focused on getting acute symptoms under control in the moment rather than the long term. However, patients continue to seek primary care in the emergency department, some knowing that they cannot be turned away for care at the ED and have access to all the services under one roof immediately, with no waiting to get appointments or having to worry about transportation to different locations for further testing. Some research shows that many patients turn to the emergency department because they felt they had to wait too long for an appointment with their primary care provider or with a specialist, such as a cardiologist. Avoiding visits to the emergency department is important to patients, to providers, and to home health agencies. This is an area where home health can play a pivotal part. Two of the major components of improving heart failure outcomes in the community, medication management and self-management, often have the same barriers as what causes people to seek care in the emergency department. These barriers often include medical barriers, such as cognitive impairment, depression, substance use, and frailty, or social barriers, such as financial burdens, food insecurity, house insecurity, intimate partner violence or elder abuse, language barriers, or limited English proficiency, low health literacy, social isolation, or transportation issues. Intuitively, we know that the emergency department is not the best place to address these issues, and this is something much better accessed in the ambulatory setting. Research has shown that improved relationships with primary care providers leads to a decreased risk of mortality, improved satisfaction, increased continuity of care, and adherence to a treatment plan when a person has an established relationship with a primary care provider. Recent studies have been showing that when a patient has a follow-up visit with a provider in the 7 days post-hospital discharge, they have a lower hospital readmission rate within a 90-day period. This makes sense considering that increased continuity of care leads patients to have increased trust and are more open to sharing details about the barriers they are having when accessing medications or managing their self-care. However, recent projections show that by 2034, the United States will have a shortage of 17 to 48,000 primary care providers. This is an opportunity for home health care agencies to help address these barriers and improve the overall quality of care for patients with heart failure. What is key in this is care coordination between the patient, the agency, and the provider. Essentially, care coordination is the act of deliberately organizing and communicating care activities among the patient and all participants involved in a person's care with the aim for better outcomes. The Institute of Medicine has pointed to care coordination as a key strategy to improve the effectiveness, safety, and efficiency of the American healthcare system. However, there are multiple obstacles that exist to improving care coordination. Our healthcare systems are disjointed, with a variety of processes. Patients are unclear about the role of the primary care provider compared to a specialist, and information is often lost due to the multiple different systems used during the handoff of care. Care management in the United States has emerged as the leading best practice for the management of the health of populations. Care management involves identifying populations with modifiable risks, aligning the care management to the needs of this population, and then identifying, preparing, and integrating appropriate personnel to deliver the services. Care management is an area of healthcare that home health agencies who manage individuals with complex diseases routinely, such as heart failure, is in a unique position to help partner with clinics and hospitals to provide this needed care coordination, especially in the setting of heart failure, where many of the best practices involve medication adherence, self-care, and communication. So, how to improve care coordination in your home health agency for a patient with heart failure? We can look at this through the care management model. First, identify the population. Complete audits of emergency room visits and hospitalizations to identify how many people are seeking care. Identify what barriers exist in your geographic territory. Then partner with your EMR or use a high-risk checklist to have the start of care clinician identify patients with heart failure who are at high risk. Next, standardize the care being provided. Use a common assessment to evaluate the patient, their medication management and adherence, and barriers to self-care. Use guidelines or care pathways to help guide clinicians along directed paths for education and the assessment of the patient. Finally, use evidence-based interventions when providing care to the patient that reduce the risk of hospitalizations or the potential for a trip to the emergency department. Refer to items from professional organizations, such as the American Heart Association's Heart Failure Guidelines. They have a toolkit for post-acute providers for guidance. Lastly, ensure that you have the right team to take care of these patients, providing training that is specific to heart failure on a regular basis, ensuring that you are following the most recent evidence-based guidelines. Finally, train staff in communication techniques, such as SBAR or IDEAL, to ensure that they can accurately convey their valuable information to provider partners. Once, as an agency, you have gathered this information and evaluated the care management of this population, the next key element in improving care coordination is to share it with the primary care providers and other specialists who are caring for these patients. Key tips to include is to first know who the providers are in your area who are caring for patients with heart failure and how it is to best communicate with them. Then you can work with your agency clinicians to have patients schedule visits with their primary care provider during the visit so that the clinician is available to answer questions and provide support as needed, helping the patient feel empowered to navigate the healthcare system. Lastly, use the standard communication methods that you've trained your staff on to communicate with providers, and consider developing summaries of care that are shared on a regular basis with these providers, ensuring that they have access to this wealth of information that is often only available to clinicians in the home. Overall, improving our communication as healthcare providers may help us overcome the multiple barriers that exist in the healthcare system. Through using a standard approach, such as care management for patients with heart failure, we can help improve outcomes for this population, potentially reducing emergency room visits and hospitalizations, and overall improving quality of life for our patients. Much of improving medication management and self-care comes down to overcoming barriers that can at times feel completely insurmountable. However, through working as teams, we, healthcare providers, can help break these barriers down for our populations. Thank you all for listening. Here are our references. I hope you've gathered some tips on how to improve care coordination for heart failure patients in your agency, and seen the importance of communication between home health agencies and primary care providers in improving patient outcomes.